Some people compare migraines to headaches, however migraines are far more intense, with effects that can last for hours and sometimes even days. Symptoms of migraines can include an intense throbbing pain in your head, nausea, vomiting, and sensitivity to light and sounds. Studies have shown that 1% of the world's population suffer from chronic migraines, and there are currently no cures for the condition. There are various treatments available, however many are concerned about the long-term adverse effects that these can have. With the emergence and growing popularity of CBD and its well-known positive effect on pain management, this video will be examining migraines and how CBD can help to suppress them. Let's start at the beginning with what a migraine is and what causes it. A migraine is a form of sensory perceptual disorder accompanied by periodic bouts of extreme headaches. In simpler terms, migraines are excruciatingly painful and sometimes disabling headaches, coupled with sensitivity to sound and light. Usually, they can last from 4 to 72 hours if left untreated. Scientists are yet to fully understand what causes migraines, although studies have proven that environmental factors and genetics are instrumental in deducing the causes of migraines. However, to avoid migraines, it is essential to know something of what triggers them. Certain foods, like aged cheese, salty and processed foods, may trigger migraines, as well as some food preservatives and sweeteners. Changes in hormonal levels, especially in women during menstrual periods, pregnancy and menopause, or the use of hormonal medications may trigger migraines in most women. Lack of adequate sleep may lead to the onset of migraines. It is important to get proper rest after a hard day's work. Studies have also revealed that stress is one of the most common triggers of migraines. Oversleeping may result in a stabbing headache akin to migraines. Loud and boisterous noise, glaring sun, some perfumes, and unusually bright lights are a sure trigger for migraines. These are some of the most common triggers that can happen to anyone. There are 4 major stages by which a migraine progresses. These stages differ from person to person. Prodrome is the first stage, known as the warning or pre-headache stage. This can occur any time between hours or days before a migraine starts. It is not accompanied by headaches, but rather symptoms of the actual event. These symptoms may help to tip off migraine sufferers of imminent migraines and include fatigue, mood swings, frequent rate of thirst and urination, distress, constipation, changes in appetite, weakness, difficulties in concentration, and a cold feeling in your body's extremities. The second stage is aura. Only 1 in 4 migraine sufferers will experience this stage. Aura manifests mainly as sight changes, although some have reported instances of changes in other senses too, including speech and movement. Aura symptoms may occur between 20 to 60 minutes before a headache manifests. Some of the symptoms of aura include blurry or flickering vision and other changes to sight, temporary hearing impairment and sensitivity to sound, sensitivity to smell and touch, slurred speech, vertigo, or dizziness. The third stage is headache. A migraine headache should not be confused with the traditional headache, as it occurs intensely, usually on one side of the head. Migraine sufferers have described the experience as a pulsing pain that often intensifies with movement. The headache itself may last from 4 to 72 hours. Other symptoms may include nausea, vomiting, upset stomach, irritability, and dizziness. Postdrome or migraine hangover, like any hangover, occurs after the main event. It is the final stage of migraine, lasting usually up to a day or 2. Migraine sufferers have reported feeling drained, confused, and depressed during this period. Other symptoms include difficulty in concentration and comprehension, elation, fatigue, and body pains. There are various kinds of migraine medications, ranging from aspirin to ibuprofen and Tylenol to over-the-counter Advil. Generally, there are 2 major categories of migraine medication. They are preventative medication and pain-relieving medication. Cannabidiol, otherwise known as CBD, can help too. Studies have revealed the effectiveness of CBD in pain management. This, combined with the various positive reports of its success in treating migraines and headaches, indicates that we would all benefit from more research in this important area. Notwithstanding, CBD has been used for centuries because of its minimal side effects, calming effects, and its clear disinclination for dependency. There are different CBD products, each with their own method of administration. The fastest way to relieve migraines when using CBD is by taking CBD oil under the tongue 2 to 3 times a day and holding it there for 60 to 90 seconds before swallowing to allow for rapid absorption into your bloodstream. In conclusion, a migraine is a profoundly serious medical condition that should not be left untreated. It is imperative to be aware of some of the indicators and/or triggers of migraines in order to not be caught unaware. The use of CBD can be quite practical, especially in chronic cases of migraines. Although it may not help with all of the symptoms of a migraine, it can be found quite effective in the management of pain without the risk of being dependent.